Hello, my name is Erica Starling, and I am doing my presentation for my DNP project. The DNP topic chosen focused on victims of sexual assault in the Alabama Crime Victims Compensation Commission program. The title of this project is Training Sexual Assault Nurse Examiners and Patient Advocates to Improve Utilization of the ACVCC Program for Sexual Assault Victims. Sexual assault victims are considered an underserved population due to the challenges they face in receiving care following an assault. Once an assault occurs, it is often a difficult process for the victim to receive care. Sexual assault clinics are designed to help ease the stress and anxiety resulting from an assault by providing medical care and referrals. Trained SANEs within clinics speak with the patient, refer them to appropriate follow-up resources, and complete sexual assault examinations. Patient advocates provide support and aid victims in any way needed. One of the resources patients from Alabama may consider is the ACVCC program. The ACVCC is a valuable yet underutilized program that assists victims in securing funds for follow-up medical appointments, mental health care, funeral costs, work loss compensation, victim rehabilitation, and legal fees and representation. Project design. The DNP project is a quality improvement process that focused on the improvement of outcomes for victims of sexual assault. This project took place in an urban sexual assault clinic in Northwest Alabama. The mission of the clinic is to provide a 24-hour compassionate, patient-centered health care, advocacy, and counseling services to those who have experienced sexual assault so that each person is empowered to begin the healing journey. The clinic also provides medical treatment for specifically sexually transmitted infections and support during pregnancy. The clinic employs approximately 15 to 20 nurses and 20 to 25 patient advocates, with 20 to 30 patients presenting to the clinic for sexual assault examinations each month. The clinic serves the 9-county Northwest Alabama region that includes Tuscaloosa, Bibb, Fayette, Greene, Hale, Lamar, Marengo, Pickens, and Sumter counties. Any patient age greater than 13 years old, regardless of gender, who have experienced a sexual assault can be evaluated at the clinic. Victims who do not wish to submit information to law enforcement can be treated and information provided anonymously to law enforcement. According to the Rape, Abuse, and Incest National Network, every 68 seconds an American is sexually assaulted. However, despite these high statistics, only 25 out of 1,000 assailants will be sentenced to prison. It is estimated there are 433,648 sexual assaults each year. RAINN defines sexual assault as non-consensual sexual contact or behaviors. Sexual behaviors can include fondling, unwanted touching, attempted rape, oral sexual acts, and penetration of the victim and or perpetrator's body. Rape is a legal term which describes a type of sexual assault that includes penetration of the vagina and or anus with any object and or body part or oral contact with genitals without consent of the victim. Statistics indicate approximately 15% of individuals who are sexually assaulted are aged 12 to 17 years, 54% are aged 18 to 34 years, 28% are aged 34 to 64 years, and 3% are aged 65 years and above. RAINN also reports 1 out of every 6 women have been a victim of rape or sexual assault in their lifetime, with 90% of rape victims being female. For this DNP project, the focus was the underutilization of the ACVCC program at a sexual assault clinic. The victims of assault are rarely assisted in the application process for the ACVCC, which led to an underutilization of the services offered. The victims were not receiving the compensation available, which created an opportunity for this quality improvement project. Project focused on the training of sexual assault nurse examiners and patient advocates in the correct application process for this vital resource. According to the National Association of Crime Victims Compensation Boards, compensation programs offer financial assistance to victims of violence, which can be crucial following assaults. By providing financial assistance, it can assist in restoring both the victim's physical and mental health by replacing lost income and or funding for care received. A needs assessment was conducted using evidence-based research and conducting both a gap analysis and SWOT analysis at the project site. The needs assessment focused on the compensation program available for victims of sexual assault in Alabama. The Urban Sexual Assault Clinic is an invaluable resource for the Northwest Alabama area. The clinic provides safe, confidential, trauma-focused care for individuals who have been victims of sexual assault. The ACVCC has a grant in place which assists victims of sexual assault with financial compensation for various expenses that accumulate after they have been assaulted. In the state of Alabama, there were 1,075 sexual assault claims made to the ACVCC, with $527,895 paid via the compensation program. According to the director of the sexual assault clinic, the ACVCC program was not being utilized by staff to provide information on and assist victims in the application process. Without the staff and advocates informing the victims, they were unaware of this valuable resource available to them. This led to an underutilization of the compensation benefits available for victims. Utilization of the ACVCC program will lead towards improving the patient experience and health of the population, as well as reducing the cost of health care. Learning objectives. The project focused on the correct application and usage of the ACVCC program. The preceptor and student worked closely to develop educational materials for staff. The staff participated in a pre-test, and after the educational session, they participated in a post-test. The objectives identified for utilization of this DNP project focus on the clinic nurses and advocates being able to complete an educational course supported by evidence to improve their knowledge of and skills in using the ACVCC program, describe how to utilize the ACVCC program, employ the application techniques learned to assist victims of sexual assault to correctly apply for the ACVCC program, prioritize the use of the AVCCC program application immediately following the educational intervention, modify current practice to include the application of the ACVCC program, achieve at least 90% on the post-test after the educational session, obtain 100% compliance with the application and utilization of the program within 2 months. The PICO question asked and answered during this project was, does educating sexual assault nurse examiners and patient advocates about the Alabama Crime Victims Compensation Commission program compared to provision of no education increase utilization of the ACVCC program by victims of sexual assault? To correctly identify areas regarding intervention and successfully progress toward the needed change, Havelock's 6 stages of planned change was applied. The 6 steps included building relationships, diagnosing the problem, gathering resources, choosing the solution, gaining acceptance, and self-renewal. Relationship building is where the needed change is identified. The second phase is decided by the change agent and determines if the change is warranted. The third phase acquires the resources available for change while gathering information. The fourth phase selects a change pathway from the available options prior to the implementation phase. The fifth phase ensures the change is seamlessly integrated along with effective communication, education, and adequate support systems. The last phase includes monitoring to ensure the change has been stabilized and maintained. The DNP project was framed utilizing Havelock stages of planned change. Relationships were built with the Urban Sexual Assault Clinic and director of the facility, along with the employed nurses and advocates. A literature review was performed with the following primary considerations: best practice in caring for victims of sexual assault, compensation programs available for victims, and general sexual assault considerations. The databases used were CINHAHL and PubMed, utilizing heading and keywords with recommendations by the Professor of Health and Services librarian at the Houston Cold Library for Jacksonville State University. The following keywords were utilized in both CINHAHL and PubMed: sexual assault compensation, sexual assault nurse examiner, sexual assault victims, SANE, and reporting. Results were narrowed by utilizing peer-reviewed academic journals and publications within the past 10 years. Unfortunately, there was not literature specifically related to the ACVCC and its use in sexual assault programs. Therefore, literature review focused on sexual assault victims, how formulated programs assisted victims, and other compensation programs that aid victims in order to assist with the development of and teaching related to this DNP project. Key findings of this literature review were that sexual assault victims rarely receive the care required. These victims often do not receive appropriate medical care, forensic care, or legal care. There was also a severe lack of utilization with compensation programs available for victims. The design was a quality improvement project for an urban sexual assault clinic. The DNP student completed a training course for the ACVCC program and developed a clinic training course for the sexual assault nurses and patient advocates. The student then educated the nurses and advocates on the proper application process to assist the patients in applying for the ACVCC program. The implementation framework utilized was the Knowledge to Action framework. This applied framework helped individuals deliver knowledge and sustainable evidence-based interventions. The ACVCC has been shown to assist victims with costs accruing after being assaulted. By utilizing the K2A framework, the student was able to apply this information into an educational session that taught the staff on the clinic of proper application techniques. There was a pre-education survey that was created by the student and preceptor that was taken by all participants to evaluate their knowledge of the ACVCC prior to the educational sessions. The education was presented via PowerPoint education. The education included explanation of the consent form, PICO question, and DNP project title. The ACVCC mission and definition was discussed, and staff were provided the opportunity to ask questions. Purpose of the project was then discussed and explained. The history of the ACVCC and how the compensation program was developed was discussed. Staff were then educated on the funding amounts available for victims and what criteria must be met to apply. The application was discussed in detail with instructions provided. Staff were then educated on how to properly submit the completed application and check the status of the application. After the teaching and implementation session was completed, post-education surveys were given to the staff and advocates to ensure they felt knowledgeable and prepared to teach victims of sexual assault on proper application techniques. There were 19 individuals educated, 3 patient advocates, and 16 SANES. All individuals completed the consent form and pre and post intervention surveys. The years of experience of the nurses and advocates in sexual assault nursing varied between less than 1 year, 1 to 5 years, and greater than 5 years. Out of the 19 individuals who attended the educational session, only 1 nurse had utilized the ACVCC program previously. The staff completed a pre-education consent form and pre-survey, which found many of the staff had not completed an application with ACVCC previously. After the educational session, the staff completed a post-survey, and the individuals who attended, 19 in total, scored a 90% or higher on the examination. The open-ended post-educational survey questions asked for any recommendations or changes to practice after implementation. The individuals recommended furthering the education to all staff at the clinic and stated they would incorporate the ACVCC program into their examination and discussions with the victims. The findings associated with this project included a statistically significant improvement in the knowledge regarding the utilization of the ACVCC program. In conclusion, sexual assault is a health concern for all individuals, regardless of age, race, or gender. Following a sexual assault is often quite difficult for victims to receive the appropriate care they require. There are various barriers which prevent victims from receiving adequate care, such as overcrowding in emergency departments, lack of nursing experience in sexual assault, fear of judgment, or fear of reporting often prevents victims from seeking assistance. Sexual assault clinics were formed and are now available for victims to visit and receive appropriate care. SANES are available to complete medical and forensic examinations. In the state of Alabama, the ACVCC is a resource available for victims, which provides financial compensation to aid victims in the post-assault phase. After the project educational session, all SANES and advocates stated they would immediately incorporate the application into their sexual assault examinations. These clinic staff members who also verbalized they would educate future SANES and advocates on the application process. This project aligns with the clinic's philosophy and mission. The staff of the sexual assault clinic will continue to assist victims of sexual assault in the application and utilization of the ACVCC. New staff members will be educated on the proper application techniques, and the director of the clinic will continue to encourage the use of the ACVCC and will speak with other clinics regarding this resource. The application process will continue to improve and become seamless. The clinic will continue to perform quality improvement processes to ensure that the victims are cared for in an appropriate manner. I would like to express my thankfulness and gratitude to the faculty of Jacksonville State University for their instruction and support during this program. This program was a valuable learning experience to create better patient outcomes and provide a higher quality of care in both my advanced practice, nursing career, and education. Thank you very much.